I am currently an ST6 in child and adolescent psychiatry in my final year of training and have taken time out of my training programme to complete a PhD. I'm studying the prevalence of autism and ADHD in young people who have had cancer and the impact of these conditions on mental health and educational outcomes. I began to pursue a career in clinical research later in my training than many doctors. I applied for an NIHR Academic Clinical Fellowship when I started my higher training at ST4 level. This is a scheme that allows you to take up to 25% of your training time for research. I also undertook an MRes in medical sciences at the University of Manchester to give me a solid foundation in conducting medical research. I enjoyed my ACF so much that I applied for funding to do a PhD and am being funded by the Christie charity. I am continuing one day a fortnight of clinical work and ad hoc on calls to maintain my clinical skills and ultimately hope to combine clinical and academic career paths. My main advice would be, if you think you might be interested in research, reach out to academics working in areas you are interested in. It's never too late in your career to get started, and your clinical experience will be invaluable. Although there are formal training pathways that doctors can get involved in early in their careers, such as during foundation training or during core training, such as the ACF, many successful researchers have used special interest time in higher training to pursue research interests or undertake additional qualifications, such as a master's or a postgraduate diploma. I have been fortunate to have had time out of training for 2 maternity leaves during my ACF and have also trained less than full time. It has been challenging at times to balance my family, clinical and research commitments. However, my supervisors have been extremely supportive, and my longer clinical training time has given me scope to fully explore my research interests and apply for PhD funding. It is extremely rewarding to be involved in research projects which have the potential to impact patient care on a wider level.